This educational video systematically takes the viewers through the steps of recognition, diagnosis, and management of the universally distressing problem of common faint or vasovagal syncope. This has been designed by Dr. Hygriv Rao, a senior electrophysiologist with expertise and experience in treating a large number of patients with this disorder. This presentation graphically illustrates the specially designed HySyn management protocol, which has proven to be effective in reducing syncope events and is easy to practice. Every section of the video is based on established scientific concepts and has been published in standard international journals. This video is primarily intended for practicing and for training physicians, but will be useful for patients and their family members who are diagnosed with this condition. Every day, countless individuals around the world experience a sudden and mysterious loss of consciousness known as syncope or fainting. This phenomenon has intrigued doctors, worried families, and shaped human experiences for centuries. There is no standard treatment or uniformly followed protocol for vasovagal syncope. This results in patients reaching out to doctors from different specialties. They undergo numerous investigations, try many medications, often with no satisfactory outcomes. But what is syncope? Syncope is a temporary loss of consciousness caused by a decrease in blood flow to the brain. While it is often harmless, it can sometimes signal more serious health issues.
Most of the causes of syncope are benign and harmless, and these are vasovagal syncope. However, one needs to evaluate the few causes of syncope which are not so benign, and the challenge for the physician is to evaluate why the syncope occurs.
The science behind syncope.
Vasovagal syncope episodes occur as this is a price that the human being pays for the erect posture that he has acquired in the evolution. If you look at the evolution, most of the animals are four-legged animals where the heart and the brain are at the same level. So it is very easy for the heart to pump blood to the brain. Whereas in the human being, because of the erect posture, the heart has to pump blood against the gravity to the brain. This becomes more of a challenge when a person suddenly stands up from a sitting or a lying position. We may not be aware, but there are millions of reflexes, cardiovascular reflexes, which are operational at this point in time. These reflexes result in constriction of blood vessels, increase in the heart rate, and increase in the pumping of the heart. And all these together result in increased blood supply to the brain in that few seconds that a person stands up from a sitting position. And these prevent the loss of consciousness. However, in some people who are prone to these events, some of the times, not all the times, these reflexes which are supposed to be operational, they do not work. And that is the reason where there is a decreased blood supply to the brain and the person falls down unconscious. The moment the person falls down unconscious, the brain and the heart are at the same level. So automatically the blood supply to the brain is restored. And in most of these cases, and almost all cases, the person regains consciousness within a few seconds. So it's important for somebody who is witnessing this event not to forcefully make an unconscious person stand up or sit up.
Patients who lose consciousness typically consult a neurologist, so let's hear their perspective.
Syncope basically means loss of consciousness. Because of that, most of the patients come to neurologists. But the fact of the matter is that most of these syncopes are not because of primary neurological disorders. I mean, no brain stroke or no seizures come with loss of consciousness alone. They are having other accompanying things. So when a loss of consciousness happens alone, it's syncope, and majority of the times the cause is with the heart or with the blood pressure. So in the heart, it is generally because of arrhythmias or some irregular heart rate in elderly. But if it happens in young people, it is because of what's called vasovagal syndrome, in which transiently the blood pressure falls down, which should be evaluated by a cardiologist.
Diagnosing syncope.
The etiology or cause of a syncope is sometimes a challenge for the physician to find. In fact, it is said that in 1/3 of the cases of syncope, the cause may not be ever found. Nevertheless, the biggest responsibility on the treating physician is to exclude the dangerous causes of syncope from the harmless or the benign causes of syncope. The most important contributory to the diagnosis is the history. The history is a narration by a person who has witnessed a syncope. It could be a friend, relative, or even a stranger. This gives the most crucial information to the physician to make a diagnosis. After this, a routine biochemistry investigations, which includes the complete blood picture, sugar, creatinine, B12, all these things are routinely done to rule out other comorbid conditions. The most crucial part of the information, apart from history, is the ECG and 2D echocardiogram, which must be done for all patients with syncope, because these two investigations to a large extent rule out the dangerous causes of syncope.
What is vasovagal syncope? Vasovagal syncope is a medical condition characterized by a sudden drop in heart rate and blood pressure. This leads to reduced blood flow to the brain and causes temporary loss of consciousness, commonly referred to as fainting.
Many times when I wake up from sleep, I lose my balance and I will fall down. Within a few seconds, I will regain my consciousness and strength.
This is not the first time I fell down, and I never knew the reason behind this until I met a cardiologist and he told me about the vasovagal syncope.
Whenever I used to work long time in my office and I get up in a jerk or jump, I used to lose my balance and fall.
In all the examples of syncope or loss of consciousness that you have seen now, these demonstrate the commonest cause of syncope, the vasovagal syncope or the neurocardiogenic syncope. These are the commonest causes and also the harmless or the benign cause. They do not result in death unless the loss of consciousness causes injuries to the head when they hit some hard object. Otherwise, by themselves, they are not fatal. In these vasovagal syncope episodes, they occur in both the genders and in all age groups, from a childhood to elderly person, as has been shown. But the one thing common in all these situations is the person falls unconscious in the erect or the standing posture. Now, these vasovagal syncopes occur either when a person is standing straight for a long time or gets up suddenly after sitting for a long time or lying down for a long time.
Diagnosing vasovagal syncope.
The main way to diagnose this condition is history, and history. It is so crucial. So it is very important to listen to a person who has witnessed the syncope event, because that gives the most valuable clue. Typically, a person with vasovagal syncope falls unconscious in an upright position or a prolonged sitting position. These two are very important. It's extremely unusual for a person to be lying down on a bed and falling unconscious in a vasovagal syncope. However, there is a confirmatory test which is useful in many of the times, and that is the head-up tilt test. In head-up tilt test, which is unfortunately not very frequently available in all centers, in this test, the patient lies down on a couch. The couch automatically, by a mechanized method, goes up to 60 or 70 degrees and remains like that for about 30 minutes. During this period, a trained doctor measures the blood pressure and pulse rates periodically with a monitor. After that time, a provocative test like a nitroglycerine is usually administered to the patient. And again, for the next 15 minutes, the blood pressure and the heart rate are monitored. The most important thing to see in this test is to bring out the syncope which the patient is having in his lifetime. So when the person is about to lose consciousness, there is often a prodrome. That means he feels some symptoms like a blackening of the eyes or some discomfort in the abdomen or a sweating. These prodrome symptoms precede the actual loss of consciousness or syncope. During this period, the blood pressure can fall or the heart rate can fall or both of them can fall. These are witnessed by the doctor. And when these occur, the head up tilt test which is being done is terminated and the couch is brought to the flat position. And the moment this is done, the person becomes totally normal. And this is reported as a positive test if these symptoms occur and the blood pressure falls or the heart rate falls or either of them fall.
Treatment for vasovagal syncope. The HySyn VVS Protocol is a feasible and effective protocol developed by Dr. Hygriv Rao and his team to prevent recurrences in patients with vasovagal syndrome. It is a simple two-step structured protocol of predominantly non-pharmacological interventions including treatment involving Tadasana yoga maneuver. Step 1 of HySyn VVS Protocol involves patient and family education and counseling, hydration, syncope avoidance, physiotherapy and Tadasana yoga maneuver. Step 2 involves reinforcement of Step 1, increased dietary salt intake, compression elastic stockings and pharmacotherapy. Step 1. Patient and family education and counseling.
Syncope has always been a devastating experience, and the most important thing that occurs is the fear. The patient is afraid and the relatives are devastated. So it is important to counsel them and explain to them the signs of vasovagal syncope, that this is not a disease but only a failure of reflexes that occur periodically time to time, and they are not a fatal at all. So they have to be explained that the most important thing, objective in treating this vasovagal syncope is to prevent injuries when they occur and to reduce the frequency of syncopal episodes. And third, to convert the syncopal episodes to pre-syncopal, that is, convert loss of consciousness into just disease spells. If one is able to achieve these things, we have done a great deal for the patient. So the family needs to be counseled and the patient needs to be counseled together that he needs to avoid standing erect for a long time. For example, standing in queue which is not moving, or just standing and talking to his friends. These things should be avoided. Now, simple advices to the patients in their daily lifestyle can be given. For example, for a housewife to use a high chair in the kitchen rather than stand and cook, and to the patients to sit down and have bath rather than stand up, and to walk rather than stand and talk. Now, walking, running, jumping, walking upstairs, playing games, these are all in fact very good. None of these ever cause vasovagal syncope. It's only after the game, if the person stands for a long time, a person falls unconscious. Similarly, cycling is good. Swimming is also not dangerous, but one must realize that one must not stand still in a pool, but continuously swim to avoid this condition.
Hydration.
The second thing after counseling is instructions on fluid and salt intake. Now, patients should not have a low salt diet. A normal salt is fine, but most important is to take adequate amount of fluids every day. They should be counseled to carry water wherever they travel and wherever they go, in areas where they are not likely to find water.
Physiotherapy and Tadasana yoga maneuver.
The third thing would involve the physiotherapy maneuvers, which are typically in our institution given by a trained physiotherapy instructor, but these can always be taken in the form of a video and instructional manuals, and they can be practiced at home. And these physiotherapy maneuvers involve all exercises which eventually aim at increasing blood flow to the brain, and it also involves an asana called a yogasana called Tadasana.
Tilt training for Vasovagal Syncope involves 5 exercises, the Tadasana and a maneuver. So of the 5 exercises, 2 are done while lying down on your back. So exercise 1, all these exercises aim to improve blood flow from your legs to heart. Exercise 1, with your arms nice and relaxed both to either side of your body, start pumping ankles. Now all the way up and then down. Repeat this for a minute. Initially, if it is difficult to repeat it for a minute, do it for 30 seconds and then slowly increase the time to 1 minute. The second exercise while lying down is to take your knee close to your chest. Now preferably not both the knees together but alternate knees. And when you do this, if you can keep your knee and ankle at the same level, it is of more use. So repeat it for a minute. These are the 2 exercises which you do while lying down. After that, turn to a side and get the comfortable sitting position with both your legs comfortably rested on the ground. The 3 exercises which we do while sitting, the first one includes again pumping your ankles, toes up, then heels up, toes up and heels up. Now we will repeat this for a minute. Now that the blood flow has started in the ankles, we'll slowly increase it up to the knee. The second exercise involves straightening the knees out. So this includes alternatively straighten your right knee, then your left knee. Then repeat that for a minute. Both the legs together a minute, not 1 minute per leg. Once this is done, we'll go more proximally. Now we'll do a static walk where we walk at a place for nearly a minute. So these are the 3 exercises which we do while sitting down. After the exercises while in lying down and sitting down, we move to the Tadasana, which we do while standing, preferably with a chair next to you, just in case if you need to sit down. The exercise or the asana is done 1 feet away from the wall, so that you can take a support of the wall in the initial stages, and as you progress you can take the wall support off. The Tadasana involves getting both your feet together, standing as erect as possible with your chest or sternum up. Now slowly, while keeping your pressure on the heel, raise your toes. You can always take the support of the wall at the back. And then now repeat by slowly lifting your heels up. Now repeat with your toes and then the heels. Ideally, this should be repeated for a minute. But start with 30 seconds and as you progress, you can do it for a minute. Once this is done, dig your heels deep into the ground, hold your thighs firmly, hold your buttocks firmly, erect or chest raised up, and raise both your hands parallel to each other. Hold this position and then slowly raise your toes. Now if you can hold this position for a minute, it is fantastic, or alternatively you can actually raise your heel and toes. Throughout this position, please ensure that you are not holding your breath. If you repeat this for a minute, that should be sufficient. This is the Tadasana maneuver. After that, or Tadasana pose. After the Tadasana pose, we will go to the maneuver which is anti-syncope. This involves either crossing your right leg over the left or left leg over the right. Here I cross my right leg over the left and then I clinch both my fists. So I press the right leg over my left leg and then push one palm over the other. Now I hold it for 10 seconds and then relax. So the 3 exercises, that is 2 exercises in lying down, 3 exercises in sitting, the Tadasana and the maneuver. All of them form one set of tilt training exercises. Preferably 6 to 8 of such sets should be done in morning and in the evening every day, but not on an empty stomach.
Step 2.
The second step involves increased dietary salt intake. we ask them to take a little more salt than they are usually taking, and we advise them to use elastic stockings which can be up to mid-waist. And the third thing is we instigate pharmacotherapy. The medications are typically like midodrine or fluorocortisone. These are to be used strictly on the instructions of physician alone and not to be taken by patients as a self-medication at any point in time.
Treatment results. The scientific evidence of the management presented in this video has been published in 2 reputed international journals, JACCEP and International Journal of Cardiology.
The HySyn protocol, which we have used for treating vasovagal syncope, has 2 steps. Majority of the patients get relief by using the first step itself. We have seen that almost 98% of the patients do not have any further syncopal episodes at all. The figure shown is a summary of our initial experience of using HySyn protocol in our institutions in patients with vasovagal syncope. The left panel depicts 157 patients before treatment, while the middle and right panels depict patients after treatment with step 1 and step 2 of HySyn protocol respectively. In the left panel, each orange circle represents a patient with syncope, which is 75 patients, while each bicolor circle represents a patient who has both syncope and disease spells or near syncope, which is 82 patients. The middle panel shows the results after first step of HySyn protocol was implemented. One can easily see that there is a marked improvement in symptoms, shown by the fact that there are only 7 orange circles depicting patients with syncope and 13 blue colored circles depicting disease spells or near syncope. Only these 20 needed to be treated with the second step of the protocol. The rightmost panel shows the final results after both the steps of the protocol were implemented. One can see no patient had syncope, meaning no orange circles at all, and only 5 blue colored circles are seen, that is only 5 patients who had disease spells or near syncope. So, starting with 157 patients with syncope, we end up with only 5 patients having just disease spells. In addition, there was a marked improvement in the quality of life, in their productivity, and there was a huge decrease in fear.
The study demonstrates a simple and effective non-pharmacological therapy protocol that could be widely used to prevent VVS recurrences and enhance patients' overall well-being.